Hi, my name is Megan LeBlanc, and today I'll be talking about the varicella virus, which is the cause of chickenpox and shingles. Chickenpox was very common prior to the 1990s, and during that time a vaccine was introduced. Prior to the vaccine, it was very common in children, not so much in adults, but over 90% of children had chickenpox by the time they were 15 years old. After the vaccine was regularly implemented into vaccination schedules, by the year 2000, the prevalence of chickenpox had decreased from around 70 to 80%. The pathophysiology of chickenpox caused by varicella virus is via an airborne route. So it's droplets in the air that are actually taken into your lungs, and that is where they infect the host via the mucosal cells in your lungs. And they do this because they have glycoprotein spikes on their cell membrane, which allows them to adhere and stick to the epithelial cells in your mucosal lining. Once they adhere to these mucosal cells, they actually invade the surrounding healthy cells because they have the glycoprotein spikes that adheres them to the cells, and then they actually fuse their cell membranes with the healthy cells and inject their viral DNA into the healthy cells, infecting them. They can also do this with our white blood cells, immune cells, and they use this method to infect macrophages and travel throughout the entire bodily system via the blood and lymph. Once the virus reaches the blood and lymph, it travels there to the lymph nodes, the spleen, and throughout the entire system, and eventually makes its way to the skin, which causes a vestibular rash throughout the entire body. Shingles is a secondary infection from varicella virus, and this happens because when your immune system begins to fight the varicella virus present in your skin and throughout your body, the viral cells respond to this immune threat by returning to an immature state. And when they return to this immature state, they then travel to your dorsal root ganglion, which is a nerve, a root of a nerve, and they reach these nerves through the skin and then travel up the nerve pathway to the dorsal root ganglion, where then they enter a dormant state. They can remain in this dormant state for years. And so once you have varicella virus, you have it for life, and it is stored there in your dorsal root ganglion. The symptoms of varicella virus chickenpox are, it's a systemic infection, so when you, it has an incubation period of about 2 weeks from initial infection or exposure to the virus. And once the virus becomes systemic in the blood, you have several symptoms that could happen. You could have a fever, headache, sore back, sore throat, or general just malaise and tiredness throughout your body because it is a systemic infection. And after the 2 weeks, you develop a rash. An average of 2 weeks after exposure, you will develop a rash throughout your body. This rash starts on the head and trunk and spreads to the extremities. And those are the main symptoms of the chickenpox from varicella virus. And then shingles, that appears later on as a separate secondary infection, so the symptoms are going to be a little bit different because it's not a systemic infection. It travels through the dorsal root ganglion back to your skin via the nerve pathway. So it's not a systemic infection on the secondary infection with shingles. It's a localized infection. So it will only affect the nerve root pathway, and there you will have a rash as well that's actually more itchy and painful than the original outbreak. And that rash can last anywhere from 2 to 4 weeks, sometimes longer in the elderly or immunocompromised. So it lasts a little bit longer, it's a little bit more painful, but it's not systemic, so you won't have the systemic symptoms such as fever, headache, sore throat, etc. The treatment for chickenpox is normally symptomatic because there's no cure for varicella virus, and it usually runs its own course and is self-limiting, so it doesn't require medical intervention, but the symptoms are usually treated using Tylenol, acetaminophen, or antihistamines, which helps reduce inflammation and any fever that can be associated with it. In adults, when an adult gets the chickenpox through varicella virus, it's actually more dangerous and can lead to further complications such as pneumonia in the lungs, which is often dangerous and can require hospitalization. But that's pretty much the treatment for the chickenpox, for the varicella virus. Then again, when shingles come, if they do, which not always do you get shingles just because you've had chickenpox, but about 10% of people will develop shingles that have had chickenpox. And it's more common in immunocompromised, the elderly, and people over 45. The treatment for shingles is typically an antiviral drug called aciclovir, and that is given for about 7 to 10 days to reduce the symptoms of the rash, the severity and the length of the rash. But this rash can last 2 to 4 weeks. And so that medication is normally given to treat shingles, and also symptomatic treatments such as topical anti-itch creams, and also just wearing loose clothing and covering the rash so that it doesn't spread to others. Shingles is only contagious through direct contact because it's not a systemic infection. And the vaccine for varicella is usually given in a combination vaccine with, it's called MMRV, and they have added that to the MMR vaccine, and now it's measles, mumps, rubella, and varicella. So that's typically given to children between 12 and 18 months old, which greatly reduces the risk of them ever contracting or having a chickenpox outbreak. And it is a live and attenuated vaccine, so it actually contains some of the live virus. And so when that's given, it also reduces the risk for developing shingles later in life, even though it is still possible because it is a live vaccine.